What is Tourette syndrome drive? Tourette syndrome is a neurological condition characterized by involuntary, repetitive movements and vocalizations called tics. These tics can manifest as sudden twitches, movements, or sounds varying in frequency and intensity among individuals. Drive requires precise control and sustained attention, which sometimes raises concerns about the ability of individuals with Tourette's to operate a vehicle safely. This article explores the factors determining whether someone with Tourette syndrome can drive, addressing legal aspects, potential challenges and available support, eligibility and legal framework. Tourette syndrome does not automatically disqualify an individual from driving. The legal framework for driving privileges typically focuses on a person's functional ability to operate a vehicle safely, rather than a specific medical diagnosis. Many jurisdictions worldwide do not have blanket bans against individuals with Tourette syndrome holding a driver's license. For instance, in the United Kingdom, individuals are encouraged to inform the driver and vehicle licensing agency if their condition affects their driving ability, but disclosure is not mandatory if tics do not pose a safety risk. Licensing authorities prioritize whether tics or associated conditions impair critical driving skills such as coordination, reaction time, and attention. Some countries, like Sweden, or regions such as Northern Ireland, encourage or require reporting the diagnosis to licensing authorities if tics interfere with driving. This allows for a review to determine if any restrictions or conditions are necessary to ensure public safety. Impact of tics on driving ability. Motor and vocal tics can potentially affect driving, though the impact varies significantly depending on their severity, frequency, and type. Motor tics, which involve sudden, uncontrollable movements, might interfere with maintaining vehicle control. Examples include head jerking that could momentarily obstruct vision, or arm and leg tics that might disrupt steering or pedal operation. Vocal tics, such as grunting, throat clearing, or involuntary utterances, can also pose challenges by distracting the driver or causing a momentary lapse in focus. While some individuals may experience tics that worsen during driving, others report that their tics remain unchanged or can even be suppressed due to the concentration required for the task. A significant majority of individuals with Tourette's report that their tics interfere minimally or not at all with driving. Many people with Tourette's also experience co-occurring conditions like attention deficit hyperactivity disorder, anxiety, or obsessive compulsive disorder, which can also influence driving ability by affecting attention, impulsivity, or reaction times. Strategies and support for drivers with Tourette's. Individuals with Tourette syndrome can employ several strategies to manage their tics and enhance driving safety. Medical management, including medication, can help reduce the severity of disruptive tics. Pharmacological treatments may involve medications that affect brain chemicals or those used for co-occurring conditions. Potential side effects of medication, such as drowsiness, should be considered as they could affect driving. Behavioral therapies, such as comprehensive behavioral intervention for tics, offer strategies including habit reversal training and relaxation techniques to help individuals gain more control over their tics. Some drivers find that focusing on the act of driving can naturally suppress tics, creating a low-stress driving environment. Minimizing distractions and taking breaks during longer trips can also be beneficial. Adaptive driving techniques or assistive technology like lane keeping assistance or adaptive cruise control can provide additional support. Professional driving evaluations by certified driver rehabilitation specialists can offer personalized guidance and assess specific needs. The assessment and licensing process.
The process for obtaining or maintaining a driver's license for individuals with Tourette syndrome typically involves an assessment of their functional driving capacity. Licensing authorities may require medical reports from treating physicians or neurologists to understand the nature and impact of the tics. In some cases, a neuropsychological evaluation might be required, especially if co-occurring conditions like ADHD are present.
Part 2. If concerns exist, a practical driving assessment may be conducted to observe the individual's performance in a real-world setting based on these evaluations. Licensing authorities might issue a standard license or restricted license with specific conditions. Or in rare cases of severe impairment, deny a license. Individuals should be transparent with their doctors and the relevant motor vehicle department about their condition to ensure appropriate evaluation and support. Failing to disclose a condition that affects driving ability can result in fines or legal consequences if an accident occurs. What is Tourette syndrome? Tourette syndrome is a neurological disorder that affects your brain and nerves. It causes you to make sudden movements or sounds called tics. Tics are involuntary, so you can't control or prevent them. Motor tics involve body movements, like eye blinking or shoulder shrugging. Vocal tics involve your voice, like sniffing or throat clearing. Motor tics tend to develop before vocal tics. Tourette syndrome, or Tourette's, usually starts in early childhood. Most of the time, tics become milder and occur less frequently in late adolescence and adulthood. Tourette syndrome is the most severe type of tic disorder. Tourette syndrome affects 1 out of every 1 for 60 children, which means that approximately 300,000 children in the US have the condition. Symptoms and causes. Symptoms of Tourette syndrome. The most common Tourette syndrome symptoms are motor and or vocal tics. Tics usually start between the ages of 5 and 7 and peak around age 12. Tics are either simple or complex. Simple tics. Simple tics are quick, repeated movements that only involve a few muscle groups. Shoulder shrugging and throat clearing are simple vocal tics. Complex tics. Oblex tics involve many movements and muscle groups. Jumping and repeating certain words or phrases are complex vocal tics. Tourette syndrome causes. Researchers don't know the exact cause of Tourette syndrome, but the condition tends to run in families, so they believe genes may play a role. Issues with how your brain breaks down. Neurotransmitters may also contribute to Tourette syndrome. Neurotransmitters, like dopamine, are chemicals in your brain that regulate behavior and movement. Risk factors. Risk factors for Tourette syndrome may include sex. Males are 3 to 4 times more likely to develop Tourette syndrome. Biological family history. Parents may pass down Tourette syndrome to children through genes. Prenatal health. Children born to people who smoked or had health complications during pregnancy may be at a higher risk for Tourette syndrome. Low birth weight may also increase the chances of Tourette syndrome, as Tourette's occur with other health conditions. Most people with Tourette's have other health conditions. These are usually mental or behavioral health disorders, including diagnosis and tests. How doctors diagnose Tourette syndrome. To diagnose Tourette syndrome, a provider checks when the tics started. They should begin before age 18. Your child must have both motor and vocal tics for over a year. There isn't a blood test or imaging exam that can detect Tourette syndrome. Instead, your child's provider will carefully review their medical history and symptoms.
Their provider may also do tests to rule out other conditions that could be causing tics. Management and treatment. Tourette syndrome treatment. Mild tics that don't affect your child's everyday activities might not need treatment. But severe tics can make it hard to function at work, school, or in social situations. Some tics can even lead to self-injury in these cases. Tourette syndrome treatment, including medication or behavioral therapy, may help. Tourette syndrome medication. For mild tics, your child's healthcare provider may recommend medications that typically treat high blood pressure. These medications include clonidine and guanfacine.
Part 3. For more severe tics, your child's provider may recommend neuroleptics.
Antipsychotic medication.
Neuroleptics are drugs that limit the activity of dopamine in your brain. Dopamine is a chemical that can increase tics. Other medications can help manage conditions that occur with Tourette's, like ADHD or OCD. Tourette syndrome therapy. The tics associated with Tourette's are involuntary, so they aren't something you or your child can control. But new therapies help people manage tics and reduce their negative effects. Comprehensive behavioral intervention for tics. CBER helps people recognize tics. Sometimes people feel a sensation right before a tic occurs, called a premonitory urge. By recognizing this urge, they may be able to mask or suppress the tic. Respond to tics. Doing a new and different action when a tic occurs is a competing response. A voluntary action, shutting your eyes, limits the involuntary action. Blinking, reduce tics. Excitement or anxiety tends to make tics worse. Staying calm and avoiding stressful situations may reduce the frequency of tics. When should I contact my healthcare provider about Tourette syndrome? Contact a healthcare provider right away if someone with Tourette syndrome becomes violent, injures himself, talks about suicide. You can call or text the Suicide and Crisis Lifeline at 988. Outlook prognosis. What is the outlook for someone living with Tourette syndrome? There's no cure for Tourette syndrome. The condition usually improves by early adulthood. Tics may still occur, but most adults don't need to continue medication or therapy. What is the life expectancy of someone with Tourette syndrome? People with Tourette syndrome have a typical life expectancy. Tourette syndrome isn't a progressive condition. It doesn't get worse over time. In many cases, the condition is mild and the tics go away on their own. A note from Cleveland Clinic. Tics among children aren't uncommon and they're usually harmless. But if you notice your child's tics becoming more severe or frequent, it's possible they may have Tourette syndrome. If you can, take a video of your child performing their tics so you can show it to their healthcare provider. Your child's provider can determine if Tourette's is affecting your child and recommend appropriate treatment. It's important to remember that your child can't control their tics. Their tics make them unique. Make your friends, loved ones, and child's teachers aware of your child's tics so they understand the condition and work with your child's provider to get them the best possible treatment to manage their tics. Care at Cleveland Clinic. Parkinson's disease, essential tremor, and dystonia are common movement disorders. And Cleveland Clinic has the expert care and support you need to manage them. So that will be it in this video. If I miss anything, please let me know in the comments. judge, bully, so thank you so much for watching. Check out my other series and music videos. Thank you so much. I see you in this one. Goodbye for now.